Why this workshop? Now, it's almost a year since resolution on promoting patient safety in healthcare was adopted in the 59th session of the Regional Committee for Southeast Asia and calls on the World Health Organization to ensure capacity building in different aspects of patient safety and to facilitate collaboration and exchange of information and best practices in the region. The resolution also calls on member states to engage patients, consumer associations, healthcare accreditation bodies, and policymakers in building safer healthcare systems and creating a culture of safety within healthcare institutions. And this workshop is an important step in response to these recommendations. As in other parts of the world, health professionals are reluctant to register or talk publicly about adverse events for fear of embarrassment, punishment, and malpractice litigation. As a result, the health system does not have a true perception of the risk it generates, and this risk which is preventable. Failures are seen as the exception, and root causes of incidents remain concealed. Incident patterns go unnoticed, and weaknesses in the system stand uncorrected.
I'm Christine. Thank you for inviting me. I am a casualty of medical negligence, which could have been prevented very easily. I got dengue fever and was being given potassium chloride intravenously. And I had just come to and my foot hurt. It was really painful. I thought they were burning my foot. And I complained several times about severe pain, but no action was taken. I told my daughter that something happened in the night, and when she looked at my foot, there was a huge burn-like mark on my foot, which turned into a wound. The hospital kept me for a week, sent me home with 3 painkillers, antibiotic. No written instructions were given. So I ended up with gangrene, and they had to then show me to an orthopedic surgeon who said they'll have to remove some of the bones. So now my foot is really, really deformed. And I have a lot of problems now with like walking, climbing stairs. I've had to change my whole life completely.
We should be told why something is going on. Like we are told to take medicine, a lot of medicines, but sometimes we're not told why. It's supposed to be very important for our health, and we are supposed to take injections and stuff. But if we're not told what happens and why we are taking it, the compliance rate is very poor. I have had instances where my friends, even myself, we haven't been told why. For example, Tessimis need to take Desferol injections every night, and we haven't been told why we should take it. So I have lost many of my friends because they didn't know how important this was for them. Even last year, I lost 2 of my very best friends due to congestive heart failure, which I believe could have been prevented if they had been told that if they did not take desferal or the other injections, it could lead to congestive heart failure or kidney failure, liver failure and such. So I think this is very, very important for us, that doctors do communicate all the risks for us and tell us why we should take our treatment. As patients, we should get all the information, even of the slightest risk, because once the risk strikes, we will be asking the doctors, why didn't you tell us?
"16 years ago, in 1991, I went to have a childbirth. 5 days later, my son had a high blood level of bilirubin. The doctor performed a change blood transfusion for my son through the umbilical cord. This caused joint infection of the hip and arm, and that's made my son a handicap on his left leg and arm forever. He suffered from pain every night and could not sleep without my relief massage for half an hour. And after 20 years old, my son will need to have the hip joint replaced. He also may need this once every 10 years throughout his life. I tried to ask for help from the hospital, but they said no. I managed to live 16 years fighting no justice, but still keeping on fighting. The more I fight, the more I lost, till I went bankrupt and also lost all the way down to human dignity.
Of course, as working in the medical field for several years, I have experienced a lot. But the main incidence is that what happened with my nephew, actually my brother's son. I got a call early in the morning, and my brother was telling me that his son woke up early in the morning with severe pain on his testes. I was thinking that it might be a torsion of testes, actually. So that much severe pain, 12 years old boy, and this is the only possible diagnosis with that acute sudden onset of pain. He diagnosed as acute epididymocarditis. So on the 5th day, even though the child was on high dose of IV antibiotics, the child started having fever. Can you imagine? So it was quite... So what to do? He was operated and his testes was being removed. And it was gangrenous, and of course, final diagnosis was torsion occurred, and nobody could diagnose.
Got a kick on my spine. Then I went meeting the spine specialist. He asked me to go through blood test, urine test, etc., etc. There's all the things. I was a bit confused. I was having a problem on my spine. Then I was asking the doctor why I'm supposed to go through. There is any connection on this and that. He was straight away explaining that I'm going to do your spine surgery. So he is not at all explain me, is it important surgery for my spine? That is the one. Second thing, what is the alternative? He didn't say anything about that. The third thing, what is the chances for the recovery? Yeah, definitely. I went to another opinion. He also a specialist. And I explained what happened with the previous doctor. So I thought of not going for the surgery. But in the meantime, if someone else in my place, with the first doctor, what he was particularly going through, trying to do the surgery, there's all the things. If something goes wrong in that surgery, I may pay my life. The price is my life.
Awareness posters, brochures, advertisements. No. It's not like that. Not like that.
No, that's what I mean. You just forget that you are a doctor and a patient.
From our study, we know that the problem is the communication skill between doctor and patient.
We as healthcare professionals should listen to even very minor complaints from the patient. We are all worried to inform patients when things go wrong. We should all agree that patients trust us. They did not complain when we did not explain also, and I am sure they will trust us if we explain more.
The overall question is partnership and patient engagement.
First of all, we should be professional, we should be ethical, competent and transparent. We should be honest, we should have compassion. Compassion will reduce all the barriers.
This is some of the areas I think we should highlight, that whether we are nurses, whether they are doctors, we should respect each other and listen if we are concerned about patient safety.
Patients are always very acute. They observe you very carefully. Most important, teach medical profession, doctors, physiotherapists, everybody to communicate and to listen.
The most important thing is, I think the doctors or the healthcare workers need to listen to us.
For patient safety, the physician or health professional have to listen more to the patient, and us as the patient have to listen more to the physician.
It's better to have some partnership with the patient. Of course, there are so many things you can learn from the patients as well.
So we change our curriculum to add more on this area, and almost every class we emphasize on the communication, how to give the bad news, how to listen to the patient carefully and pay attention to all of their complaints, and also how to explain to the patient in a way the patient can understand.
Empower mothers. We empower the parents. We provide them with information. The strategies that we are doing is that we are involving parents as much as possible, so they become co-facilitators, they become educators in their community, in their environment.
I do have my strong willing to share my own experience with others and go hand in hand in the regional level. We can together work it out and bring the know-how, knowledge we gain during this workshop to improve our error prevention system, and in a more effective manner, we shall together develop an effective error prevention system in order to save human life.
I want to see a day when patients' views and their experiences are counted, and a day when doctors admit that they can learn from us patients, and it's not only them who knows something.
We have experienced harm in medical error. We've witnessed medical error and mistakes from the very beginning to the very end, and no one in healthcare sees that entire spectrum but us. And so we have this knowledge and wisdom that I think we can contribute to solutions in a very big way.
I would like to extend an invitation and a challenge to all of us to seriously commit, as partners, our souls to create a better relationship between patients and healthcare workers, to dismantle the wall of silence, and to help reduce the fear that often paralyzes progress to build healthcare systems that are safe, compassionate, and just.
We have captured your knowledge, your visions, your wisdom, and we hope we have captured your hearts too.
It is my hope that all of you, consumers, consumer advocates, healthcare providers, and the policymakers will join hands and commit to this pledge and would return to your respective countries to make safer care a reality.